Good afternoon. On behalf of the Natrona County Emergency Operations Center, thank you for joining us for today's COVID-19 response news brief. Following today's broadcast, we'll be copying the prepared statements into the text body of our Facebook Live and YouTube live streams. Also, for those joining us online, if you have any questions or concerns, we encourage you to write those in the comment section of the live stream, and we will do our best to answer your questions online as quickly as we can. The Emergency Operations Center is working to provide free hand sanitizer to businesses in Natrona County. If you are a business in need of hand sanitizer, please contact us by calling 307-439-1248. Late last week, eligible U.S. citizens began receiving stimulus checks from the Internal Revenue Service. We want to help provide some information to help clarify the situation around payments. If you filed federal income tax for 2018 or 2019, received Social Security retirement, disability, or survivor benefits, or if you receive railroad retirement benefits through electronic direct deposit, according to the IRS, you will receive your stimulus check through electronic direct deposit sometime in the next 2 weeks. If you have not previously used electronic direct deposit, you will receive a check in the mail. Those may take several weeks to arrive. For those eligible U.S. citizens or permanent residents who did not file a federal income tax return for 2019, you can provide the necessary information to the IRS easily and quickly for no fee online. For security reasons, the IRS plans to mail a letter about the economic impact payment to the taxpayer's last known address within 15 days after the payment is made. The letter will provide information on how the payment was made and how to report if you did not receive the payment. If you are unsure that you received a legitimate letter, visit irs.gov first to protect yourself against scam artists. The IRS will not call, text you, email you, or contact you on social media asking for personal or bank account information. Also, please be cautious of emails with attachments or links claiming to have special information about economic impact payments or refunds. These are more than likely a scam. We encourage you to talk with vulnerable adults in your life about this to help keep them from being victimized by potential scammers. You can find more information about stimulus checks by visiting irs.gov/coronavirus. Thank you.
Good afternoon. I'm Haley Bloom with the Casper-Natrona County Health Department. Thank you for joining us today and for your assistance in providing and disseminating up-to-date factual information surrounding coronavirus, otherwise known as COVID-19. Today we learned of the first death from COVID-19 within the state. A hospitalized Johnson County man who contracted the virus has died. According to the Wyoming Department of Health, the older man had health conditions that put him at higher risk of severe illness and complications related to COVID-19. This is the first reported death associated with the pandemic in our state. We send our heartfelt condolences to his family and his friends. As of this morning, across our state, there have been 5,571 tests performed, 270 confirmed positive cases, and 138 of those statewide positives have now recovered. As of this morning, 16 Natrona County residents have also recovered. Personal actions that you can take to help avoid the spread of COVID-19 include following current public health orders, which encourage staying home as much as possible, staying home when you're sick and avoiding contact with other people unless you need medical attention, following common sense steps such as washing your hands often and well, covering your coughs and sneezes, and cleaning and disinfecting. Last week, we reported that the CDC has issued guidance for wearing masks in public. Today, the Natrona County health officers and other infectious disease doctors in the community are now strongly encouraging our community to adhere to this guidance. Masks should be worn in public settings and any trips outside of the home, including to grocery stores and pharmacies. The mask can only protect you if you use it properly. Once the mask is on, avoid touching it or adjusting it. Although it is difficult to get used to, touching the mask more than necessary could spread illness. While a mask may not fully protect you from others, it will help to protect the community. The reasoning behind this is that people can be asymptomatic, meaning they show no symptoms of COVID-19, but still have the virus and can be transmitting it to others. Masks help to keep your germs contained and prevent them from easily spreading to others. Masks can be made out of many household items, and some suggestions are on the CDC's website. This includes no-sew versions and other creative solutions. Please do your part and protect our community by adhering to this recommendation and others. The Wyoming Department of Health recently started reporting probable cases. They are defining this as a total count of people who are identified to be a close contact to a laboratory-confirmed COVID-19 case and develop symptoms of COVID-19 within 14 days but are not tested. For example, if a husband and wife live in the same home and the husband tests positive, if the wife does not meet the criteria for testing yet is exhibiting minor symptoms, she would be considered a probable case. In the news, you may see that other communities in the United States are also reporting probable cases. It's important to pause here and clarify that not every community is using the same definition of a probable case. In other areas, a patient may be deemed a probable case even if they have not had contact with a confirmed positive COVID-19 patient, but is experiencing symptoms and does not meet the criteria to get a test. In Natrona County, a probable case must have been confirmed as having close contact with a confirmed positive case of COVID-19. Either way, probable case numbers should not be interpreted as future confirmed cases. They should be seen as an estimate of the amount of people experiencing symptoms associated with COVID-19 that have been evaluated by a healthcare provider but did not meet the criteria to be tested at the time. This morning, the Casper and Natrona County Health Department received confirmation of an additional case, bringing the total of new cases since Thursday to 5 additional cases. This brings the total to 33 positive COVID-19 cases in the county. Here's what we know about the most recent cases. Case number 28 is a male in his 50s whose exposure is believed to be related to affiliation with WBI. Case number 29 is a female in her 60s whose exposure is believed to be related to affiliation with WBI. Case number 30 is a male in his 60s whose exposure is believed to be related to a direct contact with a known positive. Case number 31 is a male in his 40s whose exposure is unknown at this time. Case number 32 is a female in her 60s whose exposure is believed to be related to affiliation with WBI. Case number 33 is a female in her 50s whose exposure is believed to be related to affiliation with WBI. In total, there have been 602 tests performed in Natrona County between the 2 main medical facilities of Wyoming Medical Center and the Casper Natrona County Health Department. Of that, 559 were confirmed negative, 33 have been confirmed positive, and we're still pending results of 10 tests. There is evidence that we still have community transmission of COVID-19 within Natrona County. This means that there are people who did not become infected due to known contact with a positive case. This reminds us that we should be not letting up on the social distancing and hygiene measures that have been put into place. It takes everyone doing their part to effectively decrease disease. Without these measures, the system could easily be overwhelmed by those who are ill. Over the weekend, we saw an additional 5 cases. As we mentioned last week, we expect this to continue to increase as the illness is around more in the community and as testing by private lab testing facilities increases. As a reminder, the number of positive cases is not an accurate description of the amount of disease within the community. We believe there are additional people within Natrona County who are ill or have been ill with COVID-19. These people may not have met criteria for testing, may not have had the means to get tested, or may not be exhibiting symptoms, among other things. As we've stated before, the numbers of positives are likely far higher than we know. The Casper-Natrona County Health Department hotline and the Wyoming Medical Center Respiratory Clinic are still the recommended resources for those experiencing symptoms. The hotline number is 577-9892 and is operating Monday through Friday from 8 a.m. to 5 p.m. Please call ahead prior to arriving at any healthcare facility so appropriate precautions may be taken. We do not want citizens self-reporting to the emergency room. If you're experiencing significant shortness of breath, please call 911. Due to an increase in call volume, if you need help with information, events, or things unrelated to symptoms, you may contact us at covid@cnchd.org. We are responding to emails as quickly as we can. Lastly, we would like to thank you for your ongoing efforts to fight this virus in our community. We know many of you are making substantial sacrifices, including financial ones. The sacrifices you are making by staying home and social distancing are making a difference. I will now take any questions anyone may have.
Haley, we have a question from our partners at Oil City News. They asked the following question: how is flu season going in Natrona County? Are we seeing any changes in the number of people testing positive for influenza or changes in the number of people seeking medical attention for flu-like symptoms other than COVID-19? Is flu season winding down? What does that mean for resources available to attend to patients who may have COVID-19?
That's a good question. So typically we see seasonal influenza gear up more toward December and then kind of start to wind down in April. So we expect that this will be the case as we continue through April. However, we do think that many people aren't getting flu tests just because the majority of people are trying to stay home. So even if someone was sick, they may not be going in to see a provider to be able to get that flu test. As far as resources, the flu test and the COVID test are completely different, so we haven't seen any kind of shift in resources as far as testing.
Thank you, Haley.
We have a couple other questions that were submitted through Facebook that we would like to follow up on here, and then we'll also follow up on Facebook. The first was in regard to recycling options for City of Casper. So as we know, those have been suspended, but we just sent out a news release a couple days ago outlining all of the details on other options that are available. We'll be sure to link that for you on Facebook, but you can also find it at casperwy.gov. The other question that we have was, is Paradise Valley fishing access closed because there is a gate around it? We will also follow up with you. That's actually U.S. Game and Fish property, but we'll reach out to them and see if we can get some clarification on what's going on with that area. At this point, this concludes today's Natrona County Emergency Operations Center COVID-19 Response News Brief. You can rewatch this at any time on the City of Casper YouTube channel or Casper-Natrona County Health Department Facebook page. We're working diligently to continue to prepare our community to stay as healthy and safe as we possibly can through this pandemic. We want to acknowledge all of you who are doing everything you can to slow the spread and flatten the curve. It's crucial that we continue to adhere to these guidelines to protect ourselves and each other. Our next news brief will be on Wednesday, April 15th at 3 p.m. Until then, please keep yourselves and your families healthy and safe. Thank you.